Teeth Now webinar. My name is Bianca and I'm here tonight with Dr. Kirkpatrick.
Hey, Bianca.
Hello. And tonight we are going to talk all things dental implants and the full mouth implant procedure. So welcome. We're so excited that you're here. And the best part about these webinars is answering all of your questions. So we will be doing a lot of that tonight. If you are joining us, there's a chat box within YouTube that you can literally just type any question you have. We'll be able to see that. We'll even be able to show it on the screen tonight, which is a cool new feature, and answer those for you. But I'm just going to pass it off because I know we want to get things rolling.
Yeah, let's go.
All right.
I know it was like that timer, that countdown was going, and we were like, let's just go. We know you're excited about hearing about implants, so we'll jump right into it. Maybe.
It moves forward. There we go.
There we go. Okay. So just a little bit about me. If you've seen one of these webinars before, then you've seen this slide. I'm originally from Kentucky and did all my school there and did my surgery at University of Florida. And now I'm full-time practicing in Lakeland, Florida, and have been here since 2007. So I can't believe that, but that's a really long time to be in one place. And I am a board-certified oral and maxillofacial surgeon, and that is one of the most important things that you'll hear tonight. I hear people talk about this in consults when they do come in for a consult, and they'll routinely tell me that, hey, you're my second or third opinion, and, the people that I've seen before you have not been, they're either not oral surgeons or they're not board certified, and that is very important when you're thinking about who's going to be treating you and doing some surgery inside your mouth. You want to make sure that they're up to the standard of care that we all should be. So keep that in mind when you're thinking about who will be treating you with one of these types of procedures. So we do have a fairly big crew of surgeons that we're blessed to work with. Dr. Richards, myself, Dr. Nunez, Dr. Shrafi, Dr. Evans, and Dr. Z, and we're kind of spread out throughout the state of Florida and in Southern California and San Diego. Dr. Richards and I are in Lakeland. Dr. Nunez is in The Villages, and the other three, Dr. Shrafi, Dr. Evans, and Dr. Z, are in San Diego. So hopefully, if you're watching this, you're around one of these areas and you can come in to see one of us for a consult and hopefully get treated for whatever treatment that you're looking for. And here are our locations. All three are very cool places to come to for treatment. And we even have a destination vacation for your procedure that if you go to our website, you can find out some information on that about some of the local airports to fly in, the more convenient airports, and kind of hotels and a lot of good things that you guys have put together to make it easy for not only you as the patient, but your family or friends, whoever would be coming and traveling with you if you bring them with you. So these key differentiators, there's three things. I mentioned the board certified oral surgeon. The other two, they are very important as well. Zygomatic implants. So the zygomatic implants, they are specifically designed for people who we see a lot of who've had opinions from other people that have been told that they just didn't have enough bone for implants. And that's what these zygomatic implants are designed for. Usually the bone is very limited in the upper jaw, especially in the back part, because we all have the big sinuses there. And when patients have lost teeth or have periodontal disease, or just a lot of infection around the gums, the bone gets really timid around infections or when teeth are missing. So it resorbs, it shrinks down, and then it shrinks away from the tooth side, and the sinus is sitting there. So it usually leads to areas with very little bone, and either patients, if they've seen someone who wasn't really trained to put in the zygomatic implant, they were told that you either don't have enough bone for implants or you need some type of very extensive bone grafting. And that usually is a big turnoff for patients, and these zygomatic implants make it really easy and convenient for us, because we do these things routinely, that we can very easily place these implants same day without bone grafting, without waiting on the bone to consolidate or heal or harden enough to be able to put an implant in. And you can still have this procedure very predictably and have a super solid, stable foundation to anchor these bridges. And then to have the procedure under general anesthesia, here, I know you know this, but there's a lot of ways to do this. We've heard of patients just trying, providers doing this under local anesthesia where they just numb everything up. And I can imagine setting through a procedure like that under local, where you're awake and you're well aware of everything going on, but you're kind of have that numb feeling, or under IV sedation, or under general anesthesia. That's pretty much the three ways that you can have this procedure. The safest way, in our opinion, is the general anesthesia, and that's why we do that with all of these patients and to do this procedure. The big difference between the general anesthesia and the sedation is with sedation, it's an IV, the drugs go through the IV, patients are still somewhat awake, somewhat asleep, but they lose some of their protective reflexes. So if we're trying to put these implants in, and you should be using a lot of irrigation to keep the bone clean, to keep the bone cool, and that gives the implants the best chance to, succeed and fuse with your bone. And, it can become a little unsafe to do that when a patient is sedated and may not be able to cough as well. And if you're using some irrigation and some of that goes down the back of your throat, tickles the vocal cords, they can either slam shut, which that's a true emergency, or patients can aspirate some of that liquid. So we have an anesthesia team that helps us with all these cases where they come in, they do the anesthesia. We can focus on the surgery and making sure that you're getting the best treatment, surgical-wise, that you can get. And safety, you're having a true anesthesia team watching you, monitoring you, and we have a breathing tube that's placed so your airway's protected. And that just, in our opinion, is the safest way to have this procedure done and to make sure that we're able to get the implants in the best position possible to give you the support you need for your bridge. So that's, just keep those in mind when you're thinking about going for a consult somewhere, or whether it's here or at a different office. You really want to know if they tell you, oh yeah, you're going to sleep. Right. I hear patients tell me that all the time, that, hey, well, they told me they were going to put me to sleep too. I'm like, okay, so just call them back and just say, hey, I just want to ask a question about the anesthesia. Do you have an anesthesia team that's watching me, or are you doing the anesthesia and the procedure? And if they're doing both, or they don't have an anesthesia team, you want to know, is it general? Right. Is there a breathing tube? Are you protecting my airway? Or am I just sedated? Because a lot of people will say, yes, you're going to sleep, but you're truly, it's kind of like a conscious sedation. Right. Yeah.
That's a good question
to
ask.
Yeah, it's a very, very good thing to know if you're thinking about going through this procedure. So the way we do this procedure is we typically do 6 implants on the top and 4 to 6 implants on the bottom. That's considered gold standard. And the way these things are usually set up is you can see where these implants are located in this picture here. And it's usually 6 implants spread out throughout the upper jaw. And that secures the full 12-tooth bridge. And then the lower, very similar. This is showing 6 implants. Sometimes there's only enough room because of a nerve that travels on each side of the lower jaw that we put 4 implants. And sometimes there's enough bone to put 6, but patients may not need it if we can spread out 4 implants on the lower. The lower jaw and the upper jaw are 2 different bones. The lower jaw is the only bone in the face that moves. So it's got to be a very strong, independent bone. So it's a lot harder, thicker, denser than the maxilla or the upper jaw. So with the maxilla, you really need a little bit more support. So we always do 6 implants there. And the teeth, when they're on, they're screwed in to these little abutments that are connected to the implants. And that allows you to have a tremendous amount of support. So once these things have fused with your bone and healed, you're able to eat the things you want, and just kind of life goes on with a full set of teeth that are kind of screwed in stabilized with the implants. They don't come in and out. There's nothing removable, nothing covering the roof of the mouth, and none of the little flanges that go underneath the upper lip or cheeks. And from patients, if you've had partials or anything removable, or especially full denture, then you know that most people have to use adhesive or the denture glue, and it can be very annoying. It can taste bad. It can change the way some foods taste, and to not have the palate covered and to have teeth that just, you can take a bite out of an apple and kind of do things that you would with natural teeth. I mean, there's really no comparison to dentures or partials versus these screwed in fixed bridges.
We did have a couple questions come in if we want to answer those now. So the first one is about anxiety. So if I'm feeling nauseous from anxiety or nerves on the day of the procedure, would the procedure have to be canceled that day?
No, but usually coming here, actually just making the phone call to schedule the appointment is typically the hardest part for a lot of patients. Mm-hmm. Once you're here and we kind of talk to you in depth about expectations, the procedures, exactly what's going to happen and what you can expect throughout, for your impressions before the surgery, the day of surgery, most of the recovery appointments. I mean, it's very common for patients to be kind of have a phobia of the dentist. Right. And we see a lot of dental chickens, and that's okay. We understand that, and we've dealt with that, and we can definitely help you get through that. So I've had a patient that
we actually are showing a video. If you stick around to, I think it's our second to last video, but it's about his experience of being anxious. And
so whoever asked that question, you have logged in the right night to hear about this and ask that question. The only patient I guess the most severe anxiety patient about having this procedure that I've had, he actually came in, he canceled once, he came in, he's going to tell his story, but he came in for the procedure, he came into actually made it back to the area, mm-hmm. and then just left. And I went out, spoke to him and his wife in the parking lot, and just told him, like, hey, just come back in, let me get you at least through this part. And if you want to leave, you can leave. No one's going to force you. You're not tied down and forced to be here. Right. And he did great. He came back in, he did the procedure, and he was very grateful that we took the time to walk him through the process. And even that morning, because he was like genuinely scared to come in and have this, mm-hmm. even though he knew everything about what was going on, and it was something he had to come to terms with and agree to do it. And he did, and he's, looking back, he's so happy with his result and glad he went through the procedure. And he'll actually give you his kind of little brief testimony about what he went through.
Yes, it's super
how
good.
It was for him.
We do try to make everyone as comfortable as we can. That's like one of our main goals.
Because
we know a lot of people are nervous about it.
Absolutely, and if we need to, we have the ability to prescribe different medications to help you with anxiety, maybe the night before and that morning, just to kind of mm-hmm. Relax you a little bit coming in, because we know it's a big step, and we know that a lot of people are scared to even just go to sleep. I mean, I've had one surgery that I was old enough to know what was going on, and it was a few years ago. I had to have knee surgery, and that was the one thing that I didn't really care what they were going to do. I wanted my knee fixed, and I didn't care what they were going to do to it. I did, but I didn't. I was more worried about the anesthesia. And I'm putting people to sleep every day.
Yeah.
And it was just one of those things, though, that it had never been me. Mm-hmm. I was never on the other side. And, once I got there and the nurse was really good, and, she kind of walked me through she did exactly what I do. And I was kind of like, okay, I'm doing this. Mm-hmm. And it was nothing. I woke up, it was over, and I'm glad that I did it.
Yeah. Okay, we have another one. If my A1C is at 8, do I have to wait 3 months to test again before I can have my procedure?
No, you don't necessarily need to wait 3 months. 8 is I mean, if you're asking that question, you've probably read something on the internet or talked to another doctor before. And 8 is kind of that magic number that a lot of people look at in the literature with, 8 or above. It's a little bit more risky for infections and maybe the implants taking longer to fuse with the bone or not wanting to fuse with the bone. And we look at that as more of a trend and not just a specific number. If you're 8 now, but 2 months ago you were 10, then I would still feel comfortable doing this procedure on you and not waiting 3 months. But if you've been 8.2, 7.6, and now you're 8, then I would probably retest you in 3 to 4 weeks and see how you're trending. If you're doing everything you can with your medications and watching your diet, then usually that'll start trending down and we would be comfortable moving.
Awesome. All right, last one for now. Can mouthwash be part of the maintenance after the procedure? My breath is horrible due to gum disease, so mouthwash has become an indispensable part of my life.
Yeah, absolutely. And that's one thing, we prescribe you everyone an antibiotic mouthwash that you'll use at least because we close everything with some dissolvable stitches. And while they're there and just initially in the recovery, I put you on an antibiotic mouthwash, which you'll use that full bottle. And then one of my favorite things for patients to use afterwards is like a diluted peroxide, so a 50-50 mix with peroxide and water. And then it's just your mouthwash of choice, whatever flavor you like. And that we have no problem with people using mouthwash. Anything you can do to help maintain good oral hygiene. We actually give you a toothbrush, electric toothbrush, and a water pick to use. But it's more about just the action of brushing your teeth, not necessarily the toothbrush we give you or another brand. We just want you to take 2 to 3 minutes brushing your teeth. You pick your toothpaste, whichever one you like the best, and mouthwash, same thing.
Okay.
Yeah, definitely. That's not
Good
going to
question.
hurt your implants. So we're going to show a lot of before and after pictures and a few testimonial videos just so you can get an idea of exactly what we can accomplish with these implants. And all these patients are people that I've personally treated, so you'll get to see, actually some of my work. This young lady, and we see a lot of patients from all over the state of Florida, out-of-state patients, out-of-country patients, and a lot of them come here because of the no bone or been told in the past that they didn't have enough bone for implants. And they've researched, they found, maybe I'm a candidate for this zygomatic implant. So they'll come here when they find us on the internet. And like this young lady, she came from the northeastern US and she flew over, no telling how many, dental specialists, oral surgeons to get here because no one really, they talked about zygomatic implants on their website or if, she called an office. But in reality, when it really came down to, they saw her x-ray and they knew she didn't have enough bone. Oh yeah, there's zygomatic implants, but we really don't do a lot of those or we don't do them at all. And then she found us and came down, had the procedure. She did great. She healed really well. And this is her after picture with, huge smile, beautiful smile. The teeth they're really, really white on this picture. But they look, in real life, they do look a little bit more like natural than that. But they look great, and that's one of the things about this procedure as well. It's the number one reason to do this is for health and function. But you get the benefit of picking out, what you want your teeth to look like. So the color, the size, the shape of the teeth, and she wanted big teeth, she wanted to fill up her smile, and she wanted really white teeth. So that's what she got, and I think they look outstanding. But we did her upper jaw, and you can see those are the implants. She has 4 traditional implants, 2 in the front, 2 in the middle, and then those ones that are kind of angled and pointing towards the outside of the picture, those are the zygomatic implants, and they anchor into the zygomatic bone, which is the medical term for your cheekbone. So they anchor into the lower part of the cheekbone and enable us to give you a tremendous amount of support, especially on the back chewing part of the teeth, which is a very important area to get support. This is showing a before and after picture of a patient who really has hardly any bone left in the upper jaw. They've had their teeth removed, a denture for years and years and years, and the upper jaw just resorbed away. Partly because of the infection around the teeth that were there, then the teeth came out, and when the teeth are out, the body's really smart about getting rid of things that it doesn't need. So the bone starts shrinking away because you don't need the bone there, because the teeth roots are not there. And then you throw a denture on top and you start chewing, with pressure against the denture, puts pressure on the gum, which puts pressure on the bone and makes it even resorb even more. So they had literally no bone in the upper jaw and came in for, these specific zygomatic implants. And we were able to do 4 zygomatic implants, which is called a quad zygoma case. And we do 2 of these on each side. They anchor into the cheekbone, very supportive, and gives a tremendous amount of support for someone that literally had no other option. It's either live with your denture and just go through all the pain and misery that the patient was having with that, dealing with it moving around, having to use really soft foods, chew evenly on one side, because if they only chewed on one side, then it dislodged it and it couldn't take a bite out of anything. And this enabled them to have an implant bridge that once the implant's healed and they got into their final teeth, they can take a bite out of an apple, corn on the cob,
amazing.
steak. Yeah, it really is. So a huge game changer, just day-to-day activities. So this is one of our patients that is going to tell her story and just kind of go through her experience here with us at New Teeth Now.
Thanks to New Teeth Now, I can smile and I can live a healthy life. Today I got my final teeth in and I am so excited. I can't wait. I would never eat with my front teeth. Everything was either broken into pieces and put to the side. I would never bite into anything because whenever I did, they would wiggle and feel loose, so I was afraid to do that. I had loose teeth, periodontal disease, and I knew that I couldn't do dentures. I knew that I wouldn't be comfortable in them. I would never be happy. I had been to other dentists, and they had told me within 5 years you're going to lose all your teeth, and you have no bone to support your teeth. I researched, and New Teeth Now came up on my computer, and I was reading about the zygomatic implant. All I heard was it's good for no bone. I said, I think this is the place we need to go. When I met with Dr. Kirkpatrick at my consultation, made me feel very comfortable in this decision that I was making to change my life. I went in, I woke up a few hours later. Relatively easy, I guess you could say, because I don't remember it. But believe it or not, I did not have any pain, none. I myself was shocked, and I was the one going through it. I think I held the mirror at New Teeth Now for like 20 minutes, and when they took it away, I said, no, give it back. New Teeth Now changed my life in one day. My doctor believed that getting rid of my teeth and my periodontal disease had a major, major factor in my health being what it is now. She's like, if I could call New Teeth Now, I would personally. If you have periodontal disease, loose teeth, bad oral health, just make a phone call and go to the consultation. And it will definitely change your life, but you have to make the first phone call. It's life-changing, it's amazing. I couldn't be happier right now.
So you saw the video, and actually I hadn't really paid attention to the very end of that video. And I think she might have broke a light bulb when she threw her before picture.
She was real happy to throw that away.
All right, and you heard her story, you see her after, and that's just, that's very cool to be a part of her transition and see what these, having, implant supported teeth, when, if you have good teeth and you never had any dental problems, you kind of take a lot of things for granted with just, you don't think about taking a bite out of a hamburger or eating or dealing with just chronic infections every day and pain. And so it's one of those things that we can give that back to patients who need it. And I tell patients this every day during the consult. We don't have anything, no one has anything that's as good as your natural teeth when they're really good and healthy. But if you are missing your teeth, or you need to be missing them because of chronic pain, significant dental problems, infections, then these are way better than infected teeth. And it gives you the ability to have something that is as close as you can get to having your natural teeth back, and a healthy set of teeth. So who's a candidate for this procedure? We see typically, I always talk about like the three main types of patients. People who have no teeth, people who have just bad periodontal disease, or people who have like just really decayed teeth from maybe like sipping on Mountain Dew all day, every day. And they don't really have a gum disease, but they've got just a mouthful of decayed teeth. And so if you don't have any teeth, or you're unhappy with dentures, definitely you're a candidate. Mouthful of bad teeth, periodontal disease, but especially this last one. If you've ever been told that you don't have enough bone for dental implants, then definitely just call, talk to one of our coordinators. I've been here, I told you, since 2007, and I have yet to see a patient that I could not help with implants, especially having the zygomatic implants in our toolbox to be able to use. So it's just one of those things. The only patient I've ever had to turn away has been for medical reasons, because they just couldn't have the procedure because, their medical doctor wouldn't clear them to have anesthesia. All right, so the key differentiators again, there's three of these that you need to remember: the board certified oral surgeon, the zygomatic implants, and the general anesthesia. Those, just keep those in mind. There's going to be a quiz at the end of the day, and we'll go over those again. My implant coordinators, we have three: Shauna, Chastity, and Allie. They've all, been with us for years. And the very cool thing about these three young ladies is that they've been assistants. They've been dental assistants, surgical assistants. So they not only can talk to you about this procedure, but they've actually been there in the room watching this procedure, been a part of the teeth being made and inserted, and just have a ton of experience and can, answer your questions honestly because they've seen it. The restorative team here, Dr. Nafala, Dr. Dibbs, they, just like our coordinators, very experienced, have treated multiple patients for years with this, and it's pretty much what they do on a daily basis. And that experience and that knowledge, in my opinion, enables them to help get you the best result on the implants that we put in. So these are my three surgical assistants. Same thing, these young ladies, they pretty much know everything I'm going to be doing. Most of the time, they're prepared for what I'm going to be doing, even before I ask them for, a certain instrument at a different stage in the procedure. And it's, they make not only it more efficient for me and our patients, that leads to a better result, because they, like me, have been around for a long time and treating just pretty much one of these patients every day with this type of procedure. So the process that we do here at New Teeth Now, because a lot of people will say, well, what do I expect? Like, how many appointments? What am I going to be doing at these different appointments? And who am I going to see during these times? So the first step, obviously, is to call and schedule a consult with one of the coordinators and me, or Dr. Richards or one of the other surgeons. And during that consult, you'll meet with one of the implant coordinators. It's usually about an hour and 15-minute appointment. We get a CT scan, we do a good clinical exam, then we go over the CT scan with you, and you're seeing what I'm seeing. There's no, me telling you like, oh yeah, hey, we're just gonna put implants in your upper jaw. You're seeing where your implants are gonna go, and I'm looking at what size, pretty much when I see you during the consult, we're planning the surgery as well. So if you did take the next step and do the procedure, then I've already basically treatment planned your case with you. So not only do I know what I'm going to be doing, you have seen on the scan my plan for the implants. So then the next step, pre-op and impressions, that is where you come in for your impressions and to pick out really what you want your teeth to look like. With those impressions, we create like a little model of your upper and lower jaws, and that's what we use to make your temporary teeth, which I use in surgery as a guide. And then your next step after that is the surgery itself. So you come in, I've got your temporary teeth that we've had pre-made. If you have teeth, we take the teeth out, put the implants in, and then we put on your temporary teeth toward the end, usually a little bit after lunch. And then you go home. Then the next steps, post-op appointments and any adjustments if we need to. And those adjustments are usually like bite adjustments or with the occlusion, because when I set your teeth to, for your bite during surgery, we call that a sleepy bite. That may not be exactly where you're super happy at when you wake up, because your muscles may fire harder on one side than the other. And you may wake up and we put the teeth in and you say, hey, I feel like I'm only hitting over here on the right. That's okay. We adjust it. And then I see you back a week or two after that and we check the bite again. And that might have changed a little bit. And then we slightly adjust it. The same thing that if you went into your dentist and had a filling or a crown done, they always have you to tap, tap, tap on that paper. And if there's a little high spot, they polish that off. We do the same thing with these teeth. And then after that, we wait about 5 to 6 months to let your bone fuse with the implants and your gum shrink, because we know it's going to shrink, and we want that whole process to happen before we make your final teeth, because we want you to get the best fit possible. And the only way to get that is to wait 5 to 6 months, let that process happen, let your gums go through that transition, and then make your final bridge to go close that space where they've kind of shrank and got to their new happy, healthy position. And then after that, it's just care and maintenance. The same thing that I do with my natural teeth. You brush them a couple times a day, toothbrush, toothpaste, water pick, do any mouth rinses, mouthwash, like one of the questions that was asked a little earlier. And then every 6 months, you come in for a cleaning where we take the teeth off, get a good look at your gums, make sure they're clean, make sure that there's no plaque or calculus built up underneath the bridge, put them in an ultrasonic cleaner, steam them, polish them, put them back in your mouth. And one of Dr. Nafalo, one of the restorative dentists, he kind of was talking to a patient about this, and I was listening to him years ago, but it's always stuck with me, where he said, like every day you take care of your teeth. It's like washing your car. You wash your car, but every 6 months you're going to come into me and I'm going to detail it for you. So I'm going to detail your teeth. We take them off, we make sure they're clean, we make sure your gums look really good, nothing is trapped between the gum and the bridge that you might not have felt, or no like calculus or tartar is built up. If it is, we clean it off. That's how we can help you maintain these to where they'll last you decades, which is what you want from this procedure. So here's Mike. He's another one of my patients that I've treated, and I'm gonna let him. He's the guy that I was telling you that came in and just kind of had severe anxiety about the procedure, and I'm going to let him walk you through his journey with us here at New Teeth Now. Really good question. And I actually had a patient. He was very, very anxious. One of the things he did, he got online the night before his surgery, watched a zygomatic implant procedure, and he no-showed the next day. He stood me up. He literally stood me up.
Videos.
I'm here, I'm ready, the team's ready, we've got the room ready, anesthesia team's here, and there's no patient.
And
He couldn't believe you stood him up.
yeah, and I stood him up. I stood him up. He could have kicked me to the curb, but he didn't. And I'm very thankful that Dr. Kirkpatrick did not do that. Because I'm here today smiling
With your new teeth now.
with my new teeth now. Then I was diagnosed with periodontal disease, and I basically gave up. That's when things started going bad. Quick. They were just falling out of my head. When I held my grandson, he's 2 years old, he would look up at my mouth, and he would look down and shy away. My mouth scared him, and I knew I had to do something.
He actually found Dr. Kirkpatrick in New Teeth Now, but I knew that his anxiety was still going to be a problem.
And he looked over my CT scan, and he explained everything to me so I can understand. I was impressed. I felt comfortable with him, and when we left, I was excited. For the first time, excited to get this finally behind me. Well, we went through the consultation, everything went great, and the day of surgery, I was nervous. And at 7 o'clock, when I was due to be there, we called. I canceled an hour before I was supposed to be there. And I felt horrible, but I saw the next webinar, and he was telling my story.
And one of the things that scared him was he watched a video of, some clown trying to place a zygomatic implant that probably had no business doing that. And it's nothing like what you would experience here.
But we called back, and they put me back on the schedule. Day of surgery, I went into the bathroom, they gave me my gown to change into, and I started having a panic attack. I went out to the waiting room, grabbed Debbie, we have to go. So she's all confused, not knowing what's going on, and we get in the car, and I was like, I just need to get out of here. And I look up, here comes Dr. Kirkpatrick out the side door, looking all confused and concerned, and he said, what's going on? I was like, I'm just having a panic attack. I can't do it today. He's like, well, come out here and talk to me.
You're already here.
You're already here. So I get out, talk to him. He's like, you need to do this procedure, but I will walk you through everything. I got you.
For a doctor or a dentist to come out to your vehicle and walk you back in somewhere,
Yeah.
not because they want the money, not because they want anything other than what's best for them.
He really cared. He really cared. And I
He
trust.
showed how much he cared.
Yeah.
Nobody has ever done that before. I love him. I think he's great. I think he really cares about his patients.
He does.
And I wouldn't have this today if it weren't for him.
Absolutely. Absolutely.
I think that it's better for so many different things. I mean, you get more kisses, you get more hugs, you get more talking, you get more smiles, you get better pictures. I mean, definitely changes so many things.
We go out to dinner. We're more active with the family and friends, and I feel comfortable. I'm happy. I feel great. And I'm excited about the future. And I can't wait to start traveling with my wife.
You have everything to gain.
Absolutely.
And New Teeth Now, you get it the same day. You get a doctor that really cares.
And they don't treat you like a number.
No.
They treat you like a person. And that's what you get at New Teeth Now.
Okay, so you saw his video and kind of his little testimonial before. You can see what he was struggling with and dealing with on a day-to-day basis, and here his after. And people are. I mean, the fear of the dentist is a real thing, and we see a lot of people, like I said, that are patients would say they're dental chicken or very, very scared of the dentist. And, like Mike, sometimes it's a big time struggle with just coming through the doors. And that's one of the hardest things that patients do, actually, is just come through the front doors. But I do feel like that once you actually come in and meet us, we talk you through the process, we walk you through exactly what you'll go through, then you'll kind of get to know us a little bit. And like you said, we don't treat you like a number. It's not a factory. We understand this is a big procedure for a lot of people, and it's a commitment. And we want to be there with you, because the last thing I want to do is talk somebody into doing this procedure, put your implants in, and then just kind of kick you to the curb. We want to kind of walk you through not only getting the surgery and getting into a good, healthy set of teeth, but we also want these things to last. We want you to be happy and use these things for years and years and years. We're here for any questions, any problems that patients may be experiencing during the recovery, even 2 or 3 years after. If you've been going through your cleanings and all of a sudden something pops up, then the restorative team usually, they'll just let me know, hey, Dr. Kirkpatrick, Ms. Jones had a question about an area where she's having some sensitivity. And then, we'll get you back down on the surgery side and take a good look and make sure that, whatever's going on, we can fix and get you to where life goes on and you're not really thinking about your implants or your teeth or bad teeth anymore. So if you're scared of the dentist like Mike, come in for a consult. We're going to do nothing except take a CT scan and talk to you about that. So there's no needles or anything at that appointment. And then if you decide hey, I just can't do this, you don't have to come back. There's no commitment. We have had a couple other questions come in. One is, can any mouthwashes corrode the titanium implants? So I've never been asked this question before, but I'm glad someone asked it, because it's, I guess if you really don't know about this procedure, exactly what the implants are and where they're at. So the titanium implants are totally embedded in the bone under the gum. So the mouthwash never really touches the implant. The mouthwash should touch the teeth and the little connector or the little screws that ultimately are screwed into the implants. So no, any FDA approved, American Dental Association approved mouthwashes should not be toxic enough to erode your teeth, your natural teeth, your implant teeth, or your gums. And they should never even get around the implants to find out if they would corrode an implant. So no, I would not worry about mouthwashes corroding the titanium implants. The other question that came in was asking about nasal intubation. And yes, that's exactly what we do. So obviously, doing this procedure, I'm going to be working in the mouth. So if we had the breathing tube through the oral cavity, then that would really limit me and kind of, prohibit me from getting into certain areas of your mouth that I may need to either get the teeth out, clean out infection, or put the implants in the best position possible. So just like we do for a lot of the facial trauma or some of the facial cosmetics that I do, pretty much all procedures that we do on the face for facial trauma, cosmetics, this type of procedure where we're replacing teeth with implants, the breathing tube is placed through the nose. It all goes to the same spot. It's just for about that much of a distance. Instead of going straight back through the mouth, down the airway, it goes straight back through the nose and then down the airway. We actually can see the tube in the back part of the throat when we're doing this procedure that has gone through the nose and down, into your airway to protect it. So yes, you are nasally intubated under general anesthesia here. But good questions. So with, a lot of patients will ask they'll have questions afterwards, or they want to know do you have any literature or pamphlets that we can have? We have a ton of resources that our whole team here has put together to give patients, as much information as possible concerning the procedure and expectations, and some really cool things that I'll talk to you about now. But social media, huge with everything in the world today. So we have it all, from TikTok to Facebook to Instagram to YouTube, and our website has just a huge amount of information on it regarding pretty much anything you could think about with this procedure. And this New Teeth Now community that you can see on the screen, I would urge you to go on that. It is a social media New Teeth Now community that it's real patients who've had the procedure done, people who are thinking about the procedure. There's some people from our office, but it is a total free-for-all. It's not, you can ask anything you want. Well, I mean, how, he was super nice, or he said this. Has anyone, I've seen a doctor in another state that told me, was really rude, and patients will say anything on this community or ask questions about it. And we love that, because here we do try to do everything we can to make sure that if you come here for your journey with your implants, then we're not trying to do this as fast as we can and kick you out. I mean, we make you wait 5 to 6 months to get your final teeth, because we feel it's the best thing to do to get you the best result. Where some people and some clinics, they'll do this and they actually market it like it's a good thing, that you're going to get, hey, you get your final teeth on the next day or in 1 week after your surgery. Where we think that's a horrible thing to do, because we know your gums are going to shrink and you're ultimately not going to be happy with how they feel and fit. And, patients will say, well, I saw another clinic and the doctor told me that, yeah, why go there? They're going to make you wait 5 to 6 months before you can get your final teeth. We can put your final teeth on in 1 week. Well, so can I. That doesn't mean it's the right thing to do, and we definitely feel that it's not the best thing to do for you. So we wait, and you're part of our family for 5 to 6 months on the surgery side, until I'm really happy that your implants have fused with your bone, your gums have gone through the process of shrinking, and then I turn you over to the restorative side, and they make your final teeth kind of contoured to how your gums have healed and close that gap. That ultimately gets you the best result possible with these teeth. So I would urge you to go on social media if you're thinking about this, and get on the New Teeth Now community. Ask any questions you want, and I promise you'll have a patient to reach out to you that's had this procedure, and they'll tell you exactly what they went through. And we want them to. We want them to be honest with you about their experience and tell you the good, bad, and the ugly. So if you're thinking about this, definitely call the number, come in for a consult. I would love to see you and talk about what we could do to get you to your goal. Thank you guys for joining us.